when you approach a patient suffering from convulsive episodes, it's very important to determine clinically whether it's an epileptic seizure or convulsive syncope, as the further investigations and the management plan, including driving issues, are totally different. There are many studies showed as many as 1/3 of the patient initially diagnosed with epilepsy, they had a cardiovascular cause of their convulsive episodes. There are many symptoms could occur in both, and it's difficult to differentiate whether it's an epileptic seizure or convulsive episode depending on them. These include a pruning of the eyes, frothing from the mouth, urine incontinence, and tonic-clonic movements. Yes, tonic-clonic movements could occur in both, but they are usually brief in the patient of convulsive syncope. Also, the presyncopal symptoms could sometimes emulate the oral symptoms of temporal lobe epilepsy, make it difficult to differentiate whether it's seizure or syncope. On the other hand, the patient of cardiac syncope could have lack of the presyncopal symptoms. So how can differentiate clinically between the epileptic seizure and convulsive syncope? First, the epileptic patient have usually a bluish discoloration of the face or lips, while the patient of syncope look pale during the episode. Second, the epileptic patient have commonly tongue bite on the lateral side, while if the tongue bite occur in the syncopal patient, it will be on the tip of the tongue. 3. The patient of syncope usually recover completely without any post-ictal symptoms, while the epileptic patient have post-ictal symptoms like confusion, agitation, drowsiness. However, the patient of syncope, especially cardiac syncope, could have post-ictal symptoms, but it lasts for seconds up to few minutes, while the post-ictal symptoms in the epileptic patient last longer. Fourth, post-ictal paralysis, that's called toad paralysis, is a pathognomonic feature for epileptic seizure. Fifth, a significant injury like shoulder dislocation, fractures, abrasions are more common in the epileptic seizures. 6. The patient of syncope could remember the last moment before loss of consciousness. However, the patient of cardiac syncope could not able to recognize or remember anything before loss of consciousness. Last, you have to consider the convulsive syncope in the elderly patient who had the first episode in their life. The patient who have a previous history of cardiac disease like rheumatic fever, or if there's family history of sudden cardiac death in a young, or if the patient has electrolyte disturbance like hypokalemia, hyperkalemia, or hypomagnesemia. Thank you.